Does the thought of your baby's next shot appointment fill you with dread? Have you ever felt that surge of pure, helpless anxiety watching your little one cry after a vaccination? Do you know the vaccine schedule for your baby? Hey everyone, and welcome back to the Three Koi Fishes channel. We are a team of parents with over 80 years of combined experience. We personally research and vet ideas, then use AI avatars to present our findings. To be clear, the underlying expertise and research are completely human. We strive to empower you with informative content to help your child thrive. Today's topic is one that hits every new parent right in the heart: how to comfort your baby during and after shots. We're not just talking about quick fixes. We're diving into pediatrician-backed, evidence-based strategies, including the famous 5 S's to reduce your baby's distress. If you are currently facing a 2-month, 4-month, or 6-month appointment, this video is your survival guide. Stick around, because the single most effective pain relief strategy for newborns might surprise you. Before we dive into comfort techniques, I want to quickly share the U.S. Centers for Disease Control and Prevention, CDC, vaccine schedule. It's designed to protect your child during the most vulnerable stages of early development, when they're at higher risk for serious but preventable diseases. As shown in the CDC chart, many vaccines are scheduled for your newborn, covering the period from birth through age 6. These are the recommended vaccines, but it's important to discuss them with your healthcare provider, especially the COVID-19 vaccine, to determine what's right for your child. This chart includes 12 key vaccines or preventive antibodies. The dark green sections indicate immunizations and timing recommended for all children, while the light green sections show those recommended for some children. It's a helpful reference, and I've included a link to it in the description below. The science is clear: timely vaccination is the best defense. Knowing that this momentary distress is giving them lifelong protection against truly deadly diseases helps put that tiny cry into perspective, right? This next CDC table shows what each vaccine is designed to prevent. For example, the hepatitis B vaccine helps protect against chronic liver infection, liver failure, liver cancer, and even death. In contrast, the RSV vaccine is aimed at preventing lung infections. You can find this table at the same link below. If you're feeling anxious about the potential short or long-term effects of vaccinating your baby, we've addressed both the facts and common fears in an earlier video. There's a link to that below. Now, let's tackle the moment of truth: what you can do during the shot. The goal during the injection is twofold: reduce the sensation of pain and activate your baby's natural calming reflexes. This is where the famous 5 S's technique, popularized by pediatric experts like Dr. Harvey Karp and supported by the CDC for this exact purpose, becomes your secret weapon. This technique works best for babies up to about 5 months old, but the principles of deep comfort work for older infants too. S1. Swaddling, the secure hug. When you get to the clinic, swaddle your baby tightly in a blanket, but leave the specific arm or thigh that is receiving the injection exposed. Tightly wrapping them mimics the feeling of being held securely in the womb. It reduces their startle reflex and their flailing, which can amp up their stress. A secure baby is a calmer baby. S2. Side or stomach position, the calming angle. When the doctor or nurse is preparing the shot, hold your baby on their side, or sometimes on their stomach across your lap, as recommended by the nurse. This specific positioning can activate a calming reflex. Crucially, do not lay them flat on their back. Lying flat can make them feel more exposed and vulnerable. Holding them upright or on their side gives you better control and provides more skin-to-skin reassurance. S3. Shushing, the womb sound. Lean close to your baby's ear and make a loud, consistent shoo or whoosh sound. Don't whisper it. It has to be loud enough to compete with their crying, mimicking the very loud, constant noise they heard inside the womb. It's rhythmic, it's familiar, and it acts as an auditory distraction that resets their nervous system. S4. Swinging or swaying, the rhythmic rock. Keep a very gentle, rhythmic rocking or swaying motion going. This should be slow and controlled, not jerky. Rhythmic motion is strongly associated with soothing. This motion, combined with the other S's, creates a cocoon of familiar, comforting input. S5. Sucking, the ultimate pain reliever. This is arguably the most powerful tool. Babies are wired to find comfort in sucking. Option A, the best option: breastfeeding. If you breastfeed, pediatricians and the CDC agree, having the baby breastfeed during or immediately after the injection is one of the most effective, natural pain relievers available. Option B, pacifier. If you use a pacifier, offer it right before the injection. Option C, sugar water. For babies under 6 months, ask your pediatrician if they can provide or recommend a tiny amount of sugar water on the pacifier. This is a very effective, short-term pain blocker. If you're finding these CDC-recommended strategies helpful, please hit that like button. It helps us know what kind of expert-backed content you want to see more of. Remember, the best approach is to start the comfort measures before the nurse even approaches the baby. Have your swaddle ready, have your pacifier or breast ready, and be ready to shush and hold them in that comforting side position. The hard part is over, but the next 24 hours are crucial for helping your little one recover comfortably. Our research highlighted 3 main areas for home care: immediate comfort, injection site treatment, and fever/fussiness management. Let's discuss those 3 areas in detail. 1. Immediate comfort and connection. The very first thing you do when the injection is done: cuddle. Skin to skin. If possible, strip your baby down to their diaper and hold them skin to skin. This is biologically calming for both of you. Your warmth, your smell, your heartbeat, these are the ultimate regulators for a distressed infant. Remain calm. I know it's tough, but your baby is mirroring your anxiety. Take a deep breath. Use a low, calm, soothing voice. Tell them they did a great job. Your calmness is their anchor. 2. Treating the injection site, the ouchy spot. It's normal for the injection site, usually the thigh, to be red, swollen, or tender. This is actually a sign that the vaccine is doing its job and stimulating the immune system. We have 3 suggestions. A. Cool cloth. Apply a cool, damp washcloth to the site for a few minutes at a time. Do this gently. You don't want to rub too hard. This helps reduce any swelling and provides immediate, cool relief. B. Gentle massage. You can very gently rub or massage the skin near the injection site. The idea isn't to rub the medication in, but to use the sensation of touch as a distraction that overrides the lingering pinch of the shot. And C. Movement. Encourage your baby to move the limb normally. If they're using their leg, don't worry about it. The movement helps keep the discomfort from settling in. The next key area is 3. Managing minor side effects. Fussiness and fever. Fussiness and a slight fever are the most common side effects, and they usually start a few hours after the shot and last for about a day. Pain relievers. The big question: when should you give medicine or not? The CDC and pediatric experts generally recommend against giving non-aspirin pain relievers before the shot. Research suggests that preemptive dosing might slightly dull the vaccine's immune response. The general rule is to only give acetaminophen, Tylenol, or ibuprofen if age-appropriate, 6 months or older, after the shot, if your baby is running a fever or is significantly fussy and in obvious pain. Always call your pediatrician first for the correct dosage. Never guess the amount based on weight. As for feeding changes, it's completely normal for your baby to eat less for about 24 hours. Don't panic. Just offer the breast or bottle more frequently. Hydration is key. If your baby has a fever, the extra liquids are essential to prevent dehydration. If your baby develops a fever above 100.4 degrees Fahrenheit 38 degrees Celsius, a cool sponge bath can help bring their temperature down and make them more comfortable. Most reactions are minor and resolve quickly. However, you must always be aware of the signs that warrant a call to your doctor, such as high fever, a temperature of 105 degrees Fahrenheit 40.5 degrees Celsius or higher, unusual crying that lasts for several hours, or a high-pitched, inconsolable scream. Lethargy, if your baby is unusually sleepy, hard to wake up, or just seems unwell. Severe swelling, if the entire limb is red and swollen, not just the small area around the injection site. Vomiting/diarrhea, if it's severe or persistent. Trust your gut, parents. If something just feels off, call the doctor immediately. Remember, you are doing a wonderful job protecting your baby. A few minutes of tears is worth a lifetime of defense against serious illness. We want to hear from you. What is your best comfort trick that wasn't mentioned here? Let us know in the comments below. And if this research helped you feel more confident about your next appointment, consider subscribing to the channel to help promote it. We release new, research-backed parenting content every week. Thanks for watching, and we'll see you next time.